Good day! We are the first group and we are here to discuss the neuromuscular disease, particularly the Duchenne muscular dystrophy. So first, neuromuscular disease refers to the disorders that primarily affects the motor unit of our anterior horn to the muscle itself. It is considered as a lifelong challenge to maintain function kasi once na you are diagnosed with any neuromuscular disease, it can cause spasticity sa muscle, it can cause paralysis at some degree, and it can cause problems between the communication of your nerve and muscle, and it can cause for your muscle to be weak and to waste away. So, many neuromuscular disorders have no cure, but meron tayong ginagawang mga treatment para mapa-improve yung symptoms, ma-improve yung mobility ng patient, and malenten yung life nila. Kasi neuromuscular disease is a weakness in our motor unit that can be hereditary or acquired. So, meron tayong tatlong classifications ng neuromuscular dystrophy, which is yung myopathy, dystrophy, and neuropathy. So, makaklasify mo siya depending on the characteristic patterns na pinapakita niya. So, next, muscular dystrophy is a genetic disorder that makes the body's muscle weaker. It is derived from the Greek word dys, which means difficult, and trop, meaning nourish. It is due to lack of dystrophin. So, muscular dystrophy is, result siya from the weakening and breaking down ng ating skeletal muscles over time. It may differ depending on what age unang nag-show yung symptoms, anong muscle yung affected, yung degree of weakness, na igagalaw mo pa ba siya kahit papano or totally hindi na, gaano siya kabilis lumala, yun, dun mo siya madi-differ. Then, muscular dystrophy, kapag kasi wala kang dystrophin or kulang yung dystrophin sa katawan mo, is pwede siyang mag-cause ng problems in your walking, swallowing, and in your muscle coordination. So, most of the patients na diagnosed with this disease will eventually become unable to walk. So, most of the cases na naapektuhan ng DMD is males. Some of them ay may improvement naman. Some of them is very weak talaga yung muscle. And some of them end up dying on their early 20s. So, the most common type of muscular dystrophy is the Duchenne muscular dystrophy or DMD. And ayun yung pinaka-i-discuss talaga ng group namin for today. Pero, bago tayo magpunta doon, is gusto ko muna kayong bigyan ng konting idea lang about sa dystrophin. So, next, dystrophin, yan, is a protein found in muscle cell. It works together to strengthen muscle fiber and protect them from injury as muscle contracts and relax. So, ayan, dyan sa picture is yung dark violet. Ayun yung dystrophin. And, yung dystrophin natin is nagsiserve siya as chain na nagko-connect sa skeleton ng myocyte natin and sa extracellular matrix ng myocyte natin. And sa case naman kasi ng DMD, ang dystrophin ay lacking and shorter than average. Kaya every time na ginagalaw nila yung muscle ng patient, yung muscle nila, is nagre-rip apart yun. Kasi nga, wala yung nagko-connect sa skeleton myocyte and sa extracellular matrix ng myocyte. Kaya, nadadamage yung muscle and napapalitan ng fats or scar tissues. So, next, ayan, Duchenne muscular dystrophy or DMD, also known as pseudo-hypertrophic muscular dystrophy or progressive muscular dystrophy, is the most common form of muscular dystrophy. It occurs in approximately 1 in 3,500 male births. So, children diagnosed with DMD is madalas late silang nakakapaglakad, and yung calves nila, as kita nyo naman dun sa picture, ay malaki compared dun sa age nila. I mean, parang hindi siya suited na ganun agad kalaki yung calf ng bata at such a young age. So, aside dun sa fact na hirap silang maglakad or late sila nakakapaglakad, is meron ding learning difficulties. So, ang DMD ulit ay due to lack of dystrophin ulit, tulad nung nasabi ko kanina, na dystrophin is a protein made by our muscle fibers. And, ano pa ba? Ang DMD ay progressive, meaning, as you age, mas lalo siyang lumalala. And, habang tumatanda ka nga, ay nagkakaroon ng iba pang health risk, like yung sa nagkakaroon ka na ng heart problems and breathing problems. So, it affects boys kaysa sa girls. So, ayan, kita nyo nga dyan, it occurs in approximately 1 in 3,500 male births. Kasi, as we all, ang dystrophin ay nasa ano siya, it can be found sa X chromosome natin. And we all know that males have XY chromosomes and girls have XX chromosomes. So, unlike sa lalaki na ang X chromosome nila ay isa lang, ang babae ay merong dalawa. So, kung halimbawa sa girls ay yung isa nilang X chromosome ay may problem sa dystrophin, parang the other one can make up. Unlike sa boys na since iisa nga lang yung X chromosome nila, parang kapag may problem yung dystrophin is wala nang choice, ganun, wala nang ibang mapagkukunan. So without dystrophin kasi, our muscle cells will be damaged and mapapalitan siya ng scar tissues or fats over time. So nangyayari yon through a process called fibrosis. Yon. So next, ayan yung picture ng sample kapag meron diagnose ka with DMD, specifically sa calf. Sa calf yung nahanap kong picture na yan. So, as makikita nyo naman dun sa maliit na picture muna, ay sample ng non-DMD muscle tissue and sample ng DMD muscle tissue. So, dun sa non-DMD, mapapansin nyo na parang walang spaces. Tapos, dun naman sa DMD ay merong spaces kasi nga meron na siyang scar tissues and napalitan na ng fats. Kaya nagkakaroon ng spaces and ng parang mga space, 'di ba? Tapos, doon naman sa background, 'di ba? Ayan, makikita nyo na ganun yung itsura ng natin, ng calf kapag diagnose tayo with DMD. 'Di ba parang mapapaisip ka kung normal ba na ganun yung itsura ng muscle natin sa loob na may spaces? Kasi 'di ba, parang dapat siya magkakadikit para mag-function siya ng normal.
And now, it's time for the clinical presentation and progression. So, the symptoms of Duchenne's muscular dystrophy will appear between 2 and 5 years of age. However, these symptoms may not be noticed for months or years, and the disease may be misdiagnosed for years. So, unlike the other pediatric cases kung saan na-identify agad nila yung certain condition pagkasilang ng bata, here in DMD ay iba. So, most of the times, yung mga clinician natin ay nami-misdiagnose yung sakit na DMD. Subalit, pagdating sa edad na 2 to 5 years of age, dito nagsisimulang lumabas or mapansin yung simptomas ng Duchenne's muscular dystrophy. Earliest symptoms may include a reluctance to walk or run at appropriate age, falling, difficulty getting up off the floor, toe walking, clumsiness, and an increase in the size of the gastrocnemius muscle. So, in short, mas naapektuhan dito yung lower extremity ng batang may DMD. Dito niya nararamdaman yung pag-struggle sa paglalakad, pag-akyat sa hagdan, and also yung pag-balance ng kanyang weight. Pseudo-hypertrophy. This pseudo-hypertrophy is marked by a firm consistency of the muscle when palpated. So, pseudo-hypertrophy, ito yung case kung saan yung particular muscle ay lumalaki. So, instead of muscle fibers yung nagko-consist sa kanya, mas lamang and mas marami yung fats or taba. The child may develop iliotibial band or ITB contractures, which are made worse by this wide-based stance. As the weakness progresses, the child rises from the floor by climbing up the legs. This is called Gower's sign. So, So, ito yung picture ng Gower sign. Makikita nyo dyan yung bata may DMD na nag-struggle siya tumayo. So, he is using his arms or hands para ituon sa kanyang lower extremity or sa kanyang legs para maging successful yung pagtayo niya. Dahil weak nga yung kanyang lower extremity. Kaya hindi ito nakakapag-function ng maayos. As the disease progresses, there is a tendency to develop contractures. These contractures typically result in plantar flexion at the ankle, with inversion of the foot being the earliest contractures to develop, and flexion at both hips and knees typically becoming more noticeable with the onset of wheelchair dependence. So habang tumatagal yung sakit ng DMD, dito mas lalong lumalala yung nararamdaman ng bata. So kapag nagko-contract yung mga muscles niya, nagiging resulta to ng plantar flexion, especially pag nag-contract yung kanyang gastrocnemius. So magiging resulta nito yung paghihirap niya sa paglalakad and sa pag-akyat sa hagdanan. This early loss of ambulation or range of motion noted on the hamstring, hip flexors, ITBs, and heel cords limit stance and ambulation. So habang tumatagal, ini-spend niya yung time niya sa pag-upo kaysa sa nakatayo. And mas nabagal siya makatapos ng functional activities compared sa mga normal na bata. So as you can see in this picture, makikita niyo yung batang may Duchenne's muscular dystrophy, yung struggle niya sa pag-akyat sa hagdanan. So makikita niyo dyan yung ankle niya naka-plantar flexion na nagiging resulta dahil nagko-contract yung kanyang mga muscles, especially the gastrocnemius. So makikita niyo dyan na he is using his upper extremity as his support para makakapit sa railings para maging successful yung pag-akyat niya. By convention, for a child to fit the DMD categorization of a dystrophinopathy, loss of ambulation should be by the age of 13, after which the patient will be considered to have either BMD or an intermediate phenotype. So BMD means Becker's muscular dystrophy. Ito ay katulad lang din ng DMD. Subalit ang pagkakaiba niya dito ay meron siyang dystrophin pero kulang kaya hindi nagfa-function na maayos. Unlike sa DMD na absent yung kanyang dystrophin. So at this age, ginagamit nila yung partial weight bearing walker para maging suporta sa kanilang ambulation. So we have functional grades for arms and shoulders. So makikita nyo dito yung isang chart na meron tayong grade 1 hanggang grade 6. So gagamitin natin to para ma-identify and ma-determine yung grading ng kaya ng mobility or range of motion niya. So sisimulan natin sa grade 1, which is the normal. So standing with arms at the sides, the patient can abduct the arms in full circle until they touch above the head. So kapag nagawa nila ito yung normal and nakapag-function pa ng maayos yung kanilang arms and shoulders. Next is grade 2. The patient can raise the arms above the head only by flexing the elbow. So, dito nagsisimula yung pagbabago ng kanilang range of motion or yung pagpa-function ng kanilang hands and shoulders or arms and shoulders. Tapos grade 3, the patient cannot raise hands above the head but can raise an 8-ounce glass of water to the mouth using both hands if necessary. So, palala ng palala yung condition niya na lumiliit yung function ng kanyang hands and shoulder. Next is grade 4. The patient can raise hands to the mouth but cannot raise an 8-ounce glass of water to the mouth. Grade 5. The patient cannot raise hands to the mouth but can use the hands to hold a pen or to pick up pennies from a table. Last is grade 6. The patient cannot raise hands to the mouth and has no useful function of the hands. So, yung grade 6, yun yung severe case na talaga. Yung hindi niya na nagagamit yung kanyang upper extremity, especially his shoulders or his hands. Kung meron tayong functional grades para sa hands and shoulders, meron din tayong functional grades para sa hips and legs. So, as you can see in this table, makikita natin dito na meron tayong grading from grade 1 up to grade 10. So, simulan natin sa grade 1, which is the normal grade. So, walks and climbs stairs without any assistance. So, in this grade naman, ito yung nagagawa ng mga normal na tao. And even us, nagagawa natin umakyat sa hagdanan, right? Without any assistance. Next is grade 2. Walks and climbs stairs with the aid of a railing. So, dito na nagbabago yung pag-akyat niya sa hagdanan. Next is grade 3. Walks and climbs stairs slowly with the aid of a railing. So, dito bumabagal na yung pag-akyat niya sa hagdanan at malaki na yung pagbabago nito kumpara sa grade 1. So, papasok naman tayo sa grade 4. Walks unassisted and rises from a chair but cannot climb stairs. So, sa grade 4 naman, dito nakakalakad siya. Nakakatayo siya from seated position pero hindi niya na kayang umakyat sa hagdanan. Next is grade 5. Walks unassisted but cannot rise from a chair or climb stairs. Dito naman nakakapaglakad pa rin siya, subalit hindi niya na kayang tumayo galing sa seated position or even makaakyat sa hagdanan. Next is grade 6. Walks only with assistance or walks independently with long leg braces. So dito papasok yung long leg braces bilang assistant niya. Next is grade 7. Walks in long leg braces but requires assistance for balance. Grade 8. Stands in long leg braces but is unable to walk even with assistance. Next is grade 9, is in wheelchair. So ito yung stage kung saan hindi na kaya mag-ambulatory ng batang may DMD na nagkukos ng severe spine lordosis or even scoliosis dahil mahina yung spine, yung kanyang back muscle. And last is grade 10, is confined to bed or bedridden. So, makikita nyo dito meron tayong graph. So, this graphic is representation of the ages. So, makikita nyo dito yung pagbabago ng mga functional ability or mobility ng bata habang tumatagal or lumalaki yung kanyang edad. Nadadagdagan yung kanyang edad. So, habang siya ay lumalaki, bumababa yung kanyang range of motion. So, simulan natin sa upper extremity niya. Makikita nyo dito na pagdating sa edad na 8 years old, from normal na function niya is nagbabago to. Pumapasok dito yung grade 2, kung saan hindi niya na kaya abutin yung kanyang head gamit yung kanyang hand. So, habang tumatagal, lumalaki din yung percentage ng ma-acquired niya yung gantong pagbaba ng range of motion. So, sa lower extremity naman, pumapasok yung leg grade 3 sa edad na 7 years old. And so on, habang tumatagal or dadagdagan yung kanyang edad, lumalaki yung chance na ma-acquired or mabawasan yung range of motion ng bata and yung kanyang functional ability para gawin yung mga normal na ginagawa niya before. Kasama rin dito yung stand from lying, climb stairs, and even tumakbo ng 30 feet. Kasama rin dito. And getting up from the floor. Next is the common problems in patients with DMD. First, we have scoliosis. Scoliosis develops as the age of the untreated child with DMD increases. Significant curves are generally not noticed until wheelchair independence after 11 years of age. So yung scoliosis nga, isa sa malaking factor kaya bumababa yung quality of life ng mga batang may DMD. Ito yung may abnormal curves yung kanilang spine and nagiging resulta to dahil mahina or weak yung kanilang back muscles. Next, we have respiratory involvement. As the respiratory musculature atrophies, coughing becomes ineffective and pulmonary functions declining with force, vital capacity declining a mean of 5% per year. So in respiratory involvement, dito naapektuhan yung paghinga nila. So ito yung dahilan kaya maagang namamatay yung mga bata may DMD. Ito yung isa sa mga rason. So struggle din sa kanila yung pagtulog nila dahil sa breathing problem na nararamdaman nila. Next, we have gastrointestinal system. GI tract are also affected, causing constipation and the risk of acute gastric dilation or intestinal pseudo-obstruction, which can cause sudden episodes of vomiting, abdominal pain, and distension. So, in GI systems nga, dito naapektuhan yung kanilang smooth muscles and yung passageway ng mga organs nila such as the stomach. So, nagkokosto ng vomiting and mga sakit sa tiyan nila. Next, we have cardiac issue. Heart muscle is also affected by a deficiency of dystrophin, resulting in dilated cardiomyopathy. So, cardiomyopathy, yun yung nahihirapan mag-pump ng yung heart nila ng blood. Arrhythmia, yun naman yung irregular heartbeat Katulad ng kapag mabilis, we can call that tachycardia. And kapag mabagal naman, bradycardia and congestive heart failure. Next is cognition, a high rate of intellectual impairment and emotional disturbance has been associated with DMD. So in cognition, dito naapektuhan yung IQ nila. Bumababa yung IQ nila ay nagiging resulta to na nahihirapan sila makipag-communicate sa mga tao. Of course, hindi mawawala yung treatment para sa mga batang may Duchenne's muscular dystrophy. So, treatment. This program of management begins once the diagnosis is established and it is initiated concurrently with referral for parental counseling in an attempt to mitigate the guilt, hostility, and fear commonly experienced by the parents should this be desired. So, once nga na-diagnose yung bata na may DMD, doon magsisimula yung treatment plan para sa kanya. So, kulang pa ngayon yung mga treatment para sa DMD. Pero, proper management can prolong his functional activity. So, kapag yung mga parents ng mga batang may DMD ay nakakaramdam ng guilt and worries, you can guarantee their safety and good outcomes by giving positive approach. So, the clinician can propose a positive approach on the basis of the following. First, we have some of the complications which magnify the functional disability of DMD are predictable and preventable. Number 2, an active program of physical therapy may prolong ambulation and more closely approximate the normal independence of later childhood. And last, if a specific treatment ever becomes available, those in optimal physical condition are most appropriate to benefit. So you can give this positive approach para malesen yung mga guilt and worries na nararamdaman ng mga parents sila. And para maging kalmado sila while undergoing yung mga anak nila sa mga treatment na binibigay ng clinician. First, we have medical treatment. There is no pharmaceutical cure for the genetic abnormality in DMD, but corticosteroids including prednisone and deflazacort increase strength and improve functional ambulation from 6 months up to 2 years in patients with DMD. So, yun nga, according to this, walang pharmaceutical cure para sa mga bata may DMD. Pero may mga gamot na makakatulong para ma-prolong yung functional activity nila. So, first, we have prednisone. So, prednisone, despite its many side effects, keeps those affected by DMD stronger for longer. Adverse effects of prednisone include excessive weight gain, Cushing-Hoyd appearance, or yun yung paglaki ng mga pisngi. Kapag ito yung side effect ha, yung lumalaki yung pisngi, yun yung Cushing-Hoyd appearance. Behavioral abnormalities and excessive hair growth. So, yun yung mga epekto ng prednisone. Nakakatulong siya pero may side effect din siya syempre. Next is deflazacort. It has similar effects with a slightly different side effects profile and may result in less weight gain and bone demineralization but perhaps a higher risk of cataracts. Cataracts yun yung blurred or cloudy yung vision ng bata. Yun yung side effect ng deflazacort, with equivalent strength and functional benefits to prednisone. So, halos same lang din sila. Mas malala nga lang yung side effect dito sa deflazacort because of sa vision, maapektuhan. Malaking bagay yun sa bata. Kasi isipin mo yun, nahihirapan na nga sila mag-ambulate or lumakad, tapos blurred or cloudy pa yung vision nila. So, parang ang hirap na sa kanila. So, mas malaki yung side effect or risk ng deflazacort kaysa sa prednisone. And lastly, we have creatine monohydrate, a naturally occurring substance often used by bodybuilders to increase muscle performance. It's sometimes recommended for boys with DMD. So, meron din tong side effect, yung creatine monohydrate. So, ang mga side effect niya ay diarrhea, nausea, and weight gain. So, yun yung mga side effects niya. At marami pang ibang side effects ng creatine monohydrate. And now, we will proceed to the orthopedic treatment. So, orthopedic treatment, The goals of spinal surgery should include providing a stable spine, maximally correcting scoliosis, correcting pelvic obliquity, and providing sagittal plane alignment for improved comfort and function. So, in orthopedic treatment, dito pinopromote yung bone health and ina-align yung mga problems such as the scoliosis and iba pang bone problems ng batang may DMD. And not only that, may mga iba pa tayong orthopedic surgery. So, those following orthopedic surgeries are the Achilles tendon or gastrofacial lengthening. So, in this surgery, the orthopedic surgeon will make an incision at the posterior part of the leg. Then after that, he will create a Z-cut at the Achilles tendon. And therefore, the Achilles tendon will shorten and the calf muscle or gastrocnemius will lengthen. So by doing this surgery, the child with Duchenne's muscular dystrophy can now produce the dorsiflexion movement. So after ng surgery na to, magagawa niya na yung mga ambulatory movement and mag-improve siya sa mga functional activity. So next, we have young fasciotomies. So in this surgery naman, the surgeon will cut the iliotibial band na nagko-contract sa lower X para ma-release yung swelling and ma-lessen yung mga deformities. Next, we have tibialis posterior transposition. So in this surgery naman, the orthopedic surgeon will cut the tibialis posterior tendon. Then, he will transfer it to the anterior part of your tibial para magawa yung dorsiflexion na movement. And lastly, this is my favorite surgery, percutaneous tenotomies. So, in this surgery, the orthopedic surgeon will use the needle and ultrasound as their guide para hindi matamaan yung mga tissue. So, dito kasi hindi nag-iiwan ng scar unlike sa mga surgery na binanggit ko kanina. They are using needle, and ultrasound as their guide para ma-repair yung mga damaged tissue. And now we have pulmonary treatment. So a child with DMD will need to be followed by a pulmonologist beginning in the second decade of life for regular monitoring of pulmonary status, initially focusing on evaluation for natural hypoventilation. So in pulmonary treatment, they are using the ventilatory support para maging strong lalo yung kanilang mga pulmonary muscles. And they are using some techniques such as the nasal bi-level positive pressure or BPAP ventilation. So these techniques naman, they are using the nasal mask para maging strong lalo yung kanilang respiratory muscles and to provide some pressures during the respiration and inspiration. And now we have cardiac treatment. So regular cardiac echocardiogram and electrocardiogram monitoring by a cardiologist is necessary for boys with DMD, and female carriers. So in cardiac treatment nga, they are using echocardiogram para ma-monitor yung pag-pump or sound waves ng kanilang heart. And also they are giving the cardiac medications. And lastly, yung last option nila is yung cardiac transplant or heart transplant. And this is the last treatment, gastrointestinal and nutrition. A GI specialist can help with constipation issues as well as monitor for intestinal pseudo-obstruction. So yung GI specialist, tinutulungan yung bata may DMD na maiwasan yung vomiting and gastric reflux. A nutritionist can help weight gain and assist with diet recommendation in the early years. So yung dito naman, nutritionist can help the child with DMD na ma-maintain yung kanyang weight at maiwasan yung obesity and malnutrition. And dito niya minomonitor din yung kinakain ng bata, kung ito ba'y masustansya at makakatulong para mag-function siya araw-araw. Next is physical therapy examination. The role of the physical therapist in treating BMD and DMD is an important one and requires a solid understanding of both the unique features and the natural history of the disease in addition to a delicate approach to the issues related to treating a progressive and fatal disorders. So in physical therapy examination, dapat may sapat na knowledge ka sa mga possible outcomes na kakalabasan na sakit ng bata or pasyente mo. And of course, dito mo mas makikilala lalo yung pasyente mo. Like, kung yung mga family history niya, and mga ginawa niya before. Tapos, by doing physical therapy examination, dito ka makakagawa ng better treatment plan. So when discussing examination and treatment of the child with DMD, it is helpful to categorize the disease into 3 general life stage. First, we have the early or ambulatory stage. In this stage naman, hindi pa nakikita yung symptoms or napapansin. Second, the transitional phase during loss of ambulation. In this stage, napapansin na yung symptoms ng DMD such as the loss of balance and nahihirapan maglakad. And lastly, the later or wheelchair dependent for most of his functional activities. So in this stage, ito yung hindi na nagpa-function yung kanya upper and lower X and mahina na yung movement niya. Tapos yung spine niya is may deformities na such as the scoliosis. History. A thorough history should be taken and should include family history, birth and developmental history, a review of systems, including cardiac, pulmonary, GI, integumental, and musculoskeletal systems, functional mobility, social history, environmental barriers, and current durable medical equipment. So, in history naman, dito mo malalaman yung mga informations na pwedeng mag-lead sa mga sakit in the near future. So, sa pamamagitan ng pagkuha ng history ng pasyente mo, dito ka makakagawa ng better treatment plan and makakaiwas sa mga possible disease na pwedeng mangyari sa patient. Next, we have family history. The child and family may already know someone with the disease and may have a different perspective than someone diagnosed with no family members with the disease who is unfamiliar with the characteristic phenotype course. So, in family history naman, sa pagkuha nito, dito mo malalaman yung mga sakit before ng mga family members. Because in family history, there is a lot of genetic components. Kaya, kailangan mo talaga tanungin to para ma-identify and ma-determine yung mga sakit na possible na madadiagnose mo and maging ready ka na sa paggawa ng treatment plan. And lastly is the developmental history. So the physical therapist should gather information regarding the child's birth and development. Parents often report frequent falling and clumsiness as boys develop weakness. So in developmental history, dito papasok yung developmental milestone. So, itatanong mo yun sa mga family members niya or sa parents niya na nakasubaybay sa kanya sa paglaki. Para malaman mo kung sa edad na ganito, nagagawa niya ba yung ganitong reflex or action or movement. Para magka-idea ka sa mga possible outcomes or pagda-diagnose sa sakit niya. And makagawa ka ng better treatment plan.
Hi, my name is John Manuel Bansado, second year BSPT student. So, I will report the review of systems, tests and measures, and physical therapy inventions. So, the system reviews, a good pulmonary history is required to determine whenever the child has any pulmonary issues that require treatment or referral to pulmonologist. So, tests and measures, functionality, ability, muscle testing, dynamometry, and range of motion. So, functional ability, so yung functional, yung ano yung hanggang saan yung ability mo, yung hanggang saan makukuha, yung ganun. Tapos paano mo maano yung iyong ability, yung ability mo ma-reach yung isang bagay. So muscle testing is testing the muscle. So tinetest yung muscle mo kung ano ba yung, kung hanggang saan ba yung kaya mo, or yung malaki ba yung muscle mo, or kung mahina ba yung muscle mo, kailangan gamutin or para ma-function. Kung hindi ba nagana yung muscle, or weak, or ano ba siya, yung weak hindi niya maiano. So yun. So dynamometry, so range of motion. So range of motion yung hanggang saan mo nakukuha. Kuwari yung pagka-reach mo ng isang bagay, kuwari kukuhanin mo yung bola, hindi mo makuha. So meron yung range. So kuwari kukunin mo yung bola, so hindi mo naman makuha, or madali mo na kukuha. So, yun yung range of motion mo. So, meron yung degrees. So, 90 degrees, 130 degrees. So, ganun. And, we are going to the physical therapy intervention. So, is the weakness. So, yung kahinaan ng ng isang tao, kahinaan ng kung ano ba'y mahina sa kanya, so yun yung kuwari hindi niya maabot yung isang bagay, ganun. So decrease of active and passive range of motion. So hindi niya makuha, kuwari dumidecrease, bumababa yung pagkuha, yung active. So yung active, yung kuwari active niya, so bumababa rin. Tapos hindi, yung passive bumababa kasi yung passive yun yung pinaka limit niya, yun yung pinaka nakukuha niya. So loss of ambulation, decrease of functionality ability, so nawawala rin. So decrease of pulmonary function, sorry for the word. So yung bumababa siya, tapos emotional trauma, so syempre nade-depress or nagkakatrauma, ganun na rin. Tapos progress of scoliosis, so yung sa likod, yung disease na scoliosis, so nagkakaroon ng parang shape or parang curve yung likod. So pain, syempre hindi mawawala ang pain, masakit. So ganun talaga ang yung kailangan, yun yung mga nararamdaman sa cerebral palsy. So paano ba ipe-prevent? Paano ba maano? So ito, prevent and deformity. So para hindi ma-deform, kailangan i-prevent yon para hindi mangyari yung sinabi ko sa una. So prolong functional capability. So kailangan mahaba, kailangan mahaba hanggang hindi dapat may short span lang, kailangan mahaba as in infinity. So improve pulmonary function. So kailangan ma-improve yung pulmonary mo, yung sa paghinga mo, sa pag-ano mo. Kailangan ma-improve yung sa cardio mo, yung sa sa exercise mo. So facilitating development and assistance of family support and support of others. So kailangan suportado yung family mo, at saka yung parang suportado, parang chini-cheer up ka para mawala yung, syempre ma-motivate ka rin para mawala yung sakit mo or yung karanasan mo. At kailangan nilang support kasi kailangan yung treatment na yun sa mga taong ganon, sa mga may cerebral palsy or sa scoliosis ngayon yung nagkakaroon nga. So kailangan ma-push nila yung para maabot nila yung pinaka motivation nila para mawala yung pain nila, at saka yung sakit nila, at saka yung disease nila. So control pain if necessary. Kailangan mo makontrol yung pain. So sa isang bagay, kuwari ang isang pain or hindi kailangan nating kuwari masakit, wag mo siyang isipin na masakit kasi lalo siyang sasakit kasi pupunta agad sa mental mo na ay masakit, so madadami lalo yung muscle mo o yung pain mo, lalong sasakit kasi iniisip mo lalo ganun yon. Kailangan mo makontrol yung pain. Kung maganda, wag mong isipin yung pain. Alam mong masakit pero dire-diretso pa rin ang lakad, ganun. Parang normal lang sa iyo pero alam mong may sakit ka pero nasa utak mo gagaling ka at saka wala ka nararamdaman, as in para kang para kang may armor, parang ganun. So next is yung mga kailangan yung tawag dito, yung hayang gamitin, so at use. So home program, syempre kailangan ng home program. So kahit na hindi porket na nasa clinic ka o nasa rehabilitation ka, doon ka lang gagawa. Kailangan mo rin sa home kasi kailangan mo rin ma-exercise yung pinaka-muscle mo or yung katawan mo kasi kailangan hindi lang tayo pumunta sa rehabilitation para pagpagamot, hindi rin kailangan din natin may program sa bahay. So preventing deformity, so kailangan ma-prevent parang hindi ma-deform nga. So minimal spinal deformity, yun na rin yun, parang hindi minimal lang, parang kailangan ni hindi rin do sa preventing of So activity level, active exercise. So kailangan din natin exercise. So depende yan sa load na exercise. Kung kuwari dapat balance lang, hindi sobra sa cardio, hindi sobra sa pag maglo-load ka o magbubuhat ka, lalagyan konti ng yung heavy nga, yung heavy konti yung isang bagay. So hindi mawawala ang stretching. So stretching hindi mo dapat mawawala kasi kailangan mo dapat even you are going to the gym or even you're gonna play some sports or any kind of sports, kailangan mo pa rin mag-stretching. Importante yan sa lahat ng ating activities, kailangan mo na mag-stretching kasi kailangan nating ma-stretch muna yung mga muscle natin kasi pag yung tayo, baka tayo ma-injury agad. So prolong ambulation. So, Tapos, ito naman, wheelchair if needed. Wheelchair use. So, kung kailangan mo gumamit ng wheelchair, nahihirapan ka, gumamit ka. Pero kung kaya mo naman, huwag ka na gumamit ng wheelchair. Pero kung kailangan talaga, kailangan gumamit ng wheelchair. Weight control, so, syempre, pag may scoliosis ka, so, kailangan yung kain mo, control mo yung weight mo. Kasi, kailangan mo control yung weight mo kasi baka may mapasobra ka naman sa, so, kuwari, body mo, mataba. So, yung deformity mo, So, facilitating sleep, so, kailangan laging may tama tayong tulog sa mga ganyan kasi kailangan ng rest. Rest day, kailangan pa rin ng rest. Kahit may activities tayo or kailangan pa rin natin magpahinga. So, activities of daily living. So, kailangan normal lang kahit yung may dire-diretso lang. Yung alam mong masaya ka, tsaka alam mo yung dire-diretso ka lang. Yung living mo, kuwari, kakain ka, ganun, maliligo ka, yun. Respiration and consideration and facilitating family support. So, yun na rin yung kailangan ng respiratory consideration. So, kailangan huminga lagi. Take a deep breath lagi. So, facilitating family support. So, kailangan pa rin suporta ng isang pamilya para yung tao na yun para ma-motivate. So, management of pain. So, kailangan mo talagang ma-manage yung pain. Hindi laging masakit. Kung alam mo masakit, tiisin mo, mawawala din siya. Laging dasal lang at saka kailangan mo ng treatment kasi kailangan natin So, that's my report. So, kailangan din natin yung isang pain nga kailangan ma-manage at hindi laging masakit, kailangan pigilan at kailangan mawala sa isip mo. Pag malakas ang mental mo, mawawala lahat. Pag malakas ang utak mo o may naramdaman ka, tanggal ako nga iniisip mo, namomotivate sa sarili mo, ganun. So, maraming salamat. So, this is Johnny Manuel Misa Balsada, second year PhD student. So, that is my report. Thank you very much.